Thank you to Randall, a proud 917 Teamster, loading the truck every night at Southern Glazer's Wine and Spirits in Syosset so they can go out for delivery every day. Thank you to Charles, an EMT for ambulance. Thank you to both Hank Sr., a Suffolk County PD sergeant at the 2nd Precinct in Huntington, and Hank Jr., an MTA police officer at Grand Central Terminal. And thank you to Jocelyn from Selden, a nurse at Huntington Hospital. Are you an essential worker or know someone who is? And we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook or Twitter page. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Long Island Jewish Medical Center to help you sort through what's going on with COVID-19 in our communities and across the region. And of course, as always, every night we want to hear from you. Call us at the number right there at the bottom of your screen, never changes, 516-393-1800. Well, today, believe it or not, is day 94 of the COVID-19 pandemic, and Governor Cuomo says, quote, "It's breathtaking how far and how fast we've come." He says the number of new COVID cases walking in the door is at an all-time low. The governor did announce today that day camps are allowed to reopen for the summer. That's on June 29th. He says a final decision on whether to reopen sleepaway camps, that so far has not been made. Well, statewide, the number of New Yorkers infected with the virus, that stands at more than 373,000. Again, day 94. Suffolk County seeing an uptick of 275 new cases. Nassau Executive Curran says hospitalizations for COVID-19 for the first time have dipped below 300 since the numbers started being recorded. Long Island has more than 80,000 who tested positive since the pandemic began. Now, the governor today says the number of deaths is just about as low as we've seen it. That number's still now more than 24,000. I mean, just staggering numbers right here. Concern over the spread of the virus remains pretty high, especially with the protests out there, especially with the ongoing protests. Although the numbers continue to decline, the virus has claimed the lives of more than 4,000 Long Islanders. It's tough to even fathom that. All right, let's get right to our conversation. Joining us tonight, Dr. Adam Berman, Associate Chair of Emergency Medicine at Long Island Jewish Medical Center. Thank you again for your time. Friend of the show at this point because you are so generous giving your time after what must be, this must feel like one incredibly long day. I mean, day 94, but do you feel like, can you see the days between each day?
You know, it's funny, we've all kind of talked about the fact that it seems like the days are running into each other, but 94, that's quite a long time, 3 months.
How are you and your colleagues holding up at this point?
You know, I think people are happy to see that the numbers are starting to drop. Everybody's, staying vigilant to make sure that things don't bounce back. But I think people are glad to see that things seem to be improving. Yeah,
that's potentially good news. Now, there is at least a fear that we might see a spike from the protesters, at least those who are not social distancing when they're out there protesting because they're yelling. Is the fact that they're outside any help?
I mean, it's probably a help, the fact that, being in the open air means that any particulates coming out of your respiratory tract are going to have more room to spread out, but being that close together is of course a concern.
Yeah, that really is. All right, let's get to some of the questions tonight. Let's go to Massapequa Park with Richard. Are you there?
Yes, hi, how are you?
I'm doing great. What's your question tonight?
I was actually just calling, I was wondering if cirrhosis of the liver or liver disease or fatty liver can make you catch the virus easier and if you have a higher risk of death.
So cirrhosis of the liver on its own should not increase your chances of catching the virus. However, because cirrhosis of the liver might weaken your body overall, you might be at increased risk for getting sicker, but that doesn't necessarily mean that your risk for dying from the infection would be higher.
Okay. How about Gladys, West Islip, you there?
Yes. My question is, unlike asymptomatic persons who have the virus, show no symptoms, and have a shorter duration of viral shedding, can COVID-19 lie dormant in the body and resurface from time to time?
As far as I know, there is no evidence that the coronavirus will lay dormant in people's body. Like you said, there may be asymptomatic people who are shedding the virus, but to have it lay completely dormant and then resurface is not something that I think is happening with this virus.
You know, Doctor, I get this a lot on social media. When someone that you encounter has had coronavirus and has recovered and has the antibodies, should we still be at least leery of being around them?
You know, that's a really good question. I think a lot of people have that question. We should definitely not let our guards down. We still need to be social distancing, wearing the masks, really, practicing good hand hygiene. I don't think anybody really knows exactly how much protection we get if we have antibodies after having the virus.
Yeah. All right. How about in Hampton Bays, Anthony, you there?
Yes, thank you. Hi. I've been reading a lot about the blood clotting issues and low blood oxygen issues caused by the virus. I have thalassemia minor anemia, which affects my blood oxygen, and I also had a spontaneous effort-induced thrombosis in my cephalic vein. My blood test showed no genetic clotting disorder, which is very odd since both my mother and sister have factor V Leiden. Should I be taking serious precautions like using only N95 masks and using blood thinners?
I mean, I think that you should definitely take the same precautions that everybody else is taking in terms of using masks, hand washing. I probably wouldn't advise starting a blood thinner without consulting a doctor or whoever your healthcare provider is. If you don't have any evidence of a blood clot right now, there's really no good evidence that prophylactically taking blood thinners is helpful for this.
Okay. Are we still hearing good things about remdesivir as far as a treatment, not necessarily a vaccine?
There's been, the big study that came out a couple of weeks ago showed that there was about a 4-day reduction in length of hospital stay for patients who were on remdesivir. Whether or not it's sort of a game changer is still up to sort of the verdict of science, I guess. But right now, it is still being used in select patients.
Okay. How about Marcia? Marcia, you there?
Yes. Hello. If a child of 10 has asthma, is that child more susceptible to COVID-19 and the MIS-C?
The asthma on its own wouldn't necessarily make you more susceptible, but it may increase your risk for complications or for having a worse course of the virus. But having asthma on its own doesn't necessarily mean that you're at increased risk for catching it.
Okay, and how about Mary? Mary, you there?
Yes, I am.
What's your question tonight?
Yes, my question is that with getting the COVID testing, which is the better test to use? Is it the nasal swab or the blood test?
Well, the nasal swab and the blood test look for two different things. The nasal swab looks for the actual presence of the virus, and the blood looks for evidence that the virus has already been in your body. So they look at two different things. Combined, you can get more information than one alone, but both of them are good tests.
Okay. How about Louise? Louise, you there?
Yes. This is, thank you, doctor, for your service and for taking my question. I had the virus 3 weeks ago, and I had to get retested on Friday because my doctor would not see me if I was not negative, and it came back preventive positive. And does that mean that I have to quarantine, and am I contagious, and when should I be retested again?
That was for the antibody test or for the nasal swab?
Virus, the nasal swab.
I mean, presumptive positive is difficult to interpret in people who have previously had the infection. We're not sure exactly how long the swab will be positive after you have the infection. So it doesn't necessarily mean that you need to quarantine, but you definitely need to continue the same social distancing, masks, and hand hygiene.
So, doctor, at this point, what types of patients are you seeing in the ER as far as COVID positive patients? Are they more adults? Are they males? Are they females? Are they children?
on the whole, we're seeing more adults than children, and I think, as far as I know, it's pretty split between men and women. We're actually seeing people come in for a lot of things besides the coronavirus, but who happen to have the coronavirus or previously had the coronavirus.
Okay. And what's your advice to those people who maybe at home are feeling not well, but it's not a coronavirus issue? Are the ERs now safe for people to come in?
Absolutely. Absolutely. All the emergency departments are taking a lot of precautions to stay safe, to separate patients as much as they can. It is absolutely safe to come to the emergency department, and if you need us, you should come.
Okay. Let's try to squeeze Sue in there. Sue, you there?
Yes.
What's your question, Knight?
Okay. I have a family member. I'm 79 years old, and they have cancer, and it's a situation where I really need to see this person. I already canceled 2 flights because of the airlines, and I want to know: is there a way I can travel there? I'm following all the proper restrictions. I've never been tested, and I'm okay. If I go there, I would have to be quarantined, they said, for 2 weeks. And but is there any way around that by testing to be able to see this person sooner? Because it's
okay.
A situation
let's try to get the doctor to answer that if he can real quickly.
I mean, the truth is that you have to weigh the risks and the benefits. There's probably no good way to say you're completely safe, but practicing good hygiene is going to be the most important thing.
Yeah, Sue, our heart goes out to you. I wish you the best with your family member as well. We're going to take a real quick break. When we come back, we're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we do want to hear from you. So call us now with your questions. The number never changes, right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Adam Berman, the Associate Chair of Emergency Medicine at Long Island Jewish Medical Center. Thank you again for your time tonight. Let me ask you this. We're at least in meteorological summer. We're going to soon go into astronomical summer. And then there may be a pause in the virus, but we're maybe a second wave in the fall. How are you in the medical field? What kind of discussions are you guys having about preparing for a potential second wave?
Well, we're already looking, forward to whether or not that second wave is going to happen, trying to decide what we're going to do as we move again into the fall and have to deal with maybe the possibility of influenza and the coronavirus, trying to think about how we're going to tackle that. So we're definitely thinking ahead.
Yeah, that could potentially be complicated. What about the dangers of well, actually, I'll ask that a little bit later. Let's get to Annie. I don't want to have her wait any longer. Annie, you there?
Yes.
What's your question tonight?
Yeah, hi. Thank you for taking my call. I have a 10-month-old grandson and a 3.5-year-old granddaughter. I've been social distancing with them. I have seen them. It's been outside in the yard. I wear my gloves and my mask, but my daughter is going back to work. My son-in-law has been out there working. I don't have the coronavirus. I tested negative for any antibiotics. So my concern is I'm going to be babysitting for them a few times a week, and I don't know if I should be wearing my gloves and mask because now I'm going to be in their home, in their environment. Of course, I have to pick up the 10-month-old and so forth and so on. And I'm just curious how I go about my day with them.
Sure. So the truth is that you should probably wear a mask in order to, of course, protect yourself and protect your family. If you're practicing good hand hygiene, you probably don't need to wear gloves. In fact, wearing gloves, you might actually spread things around a little bit more. So washing your hands really well or using a good sanitizer on your hands is probably enough, but I definitely recommend wearing a mask.
Okay. How about David? David, you there? Malvern?
Hi, this is David, Dr. Berman. Thanks for taking my call.
Thank you.
Just a quick question. We cover ourselves with the masks. I'm just wondering if you can get the coronavirus in your eyes or through your eyes.
So it's not 100% clear, but there have been some reports of having viral symptoms related to the transmission of the coronavirus through the eyes. There is a mucosal surface the same way that you have on the inside of your mouth. And so it's possible. It's one of the reasons why it's recommended that you not touch your face and your eyes when you're around people who could have the coronavirus.
So, doctor, what advice would you give to someone who came into the emergency room and was a contact wearer? Should people start wearing glasses if they need to?
I don't think it's necessarily at that point, but people need to continue to clean their contacts normally, not touch their face and their eyes, sort of the basics that can actually go a long way.
Okay. How about Susan? You there?
Dr. Berman, thank you for taking my phone call.
Thank you.
My question is, I had the coronavirus, and now I went for the antibody test. So it came back positive with a value of 7.5H and a positive A. So I don't know what that all means.
So the truth is, the positive A means, of course, that you were exposed to the coronavirus, which it sounds like you knew. The index, the number, the 7 that you're talking about, we're not 100% sure how to interpret that. We don't know what is considered a good level and what's considered a not good level to say that you have protection.
Okay. That was Susan, right? Okay. Doctor, let me ask you, I wanted to ask you this before, but at least from the medical perspective, I don't want to put you on a policy level, but from a medical perspective, you see the patients, you're seeing the advancements that we're having as far as treatments. Are we opening up too fast, or is this about right?
I think it's hard to say. We definitely are going to get to a point where we're able to open up somewhat, but I think that it's going to have to be, at the same time, we're going to have to be very careful to continue practicing social distancing as much as we can and to do the things that we've been doing to prevent the spread of the virus. We can't have a false sense of security and think that we can 100% go back to the way that things used to be.
Yeah, and again, I think this is important to make this point over and over again. Why should we be wearing masks in the public? If I'm out there and I say, look, I've been tested, I'm negative. Is it okay for me not to wear a mask when I'm around and not social distancing?
It's really not. A mask does two things. It protects other people and it protects you. And the truth is, we don't know enough about this virus to know who truly is protected and who cannot spread it. So the safest thing to do for yourself and for others is to wear the mask.
Okay. Yeah, great advice. And you can't say that enough, because I hear it all the time, people thinking that they're just protecting themselves when really I'm protecting you and you're protecting me. It's really what's going on. Unfortunately, that is all the time we have. Thank you again, Dr. Berman. Stay safe, stay healthy. You're one of the heroes out there, and we appreciate what you do every single day, every night. Thank you so much. And thank you to our viewers. And thank you for calling in. And we'll see you tomorrow night, 7 o'clock. Stay safe. I'm Stone Grissom. Good night.